Artificial intelligence is pretty much everywhere right now. It's not just ChatGPT, weird videos, and misinformation.
What if the technology could save your life? West 2's Jesse Pagan takes us to Lake Nona Hospital, where the AI will see you now.
Inside HCA's UCF Lake Nona Hospital.
So I just walk in the door, hit start, put the phone in my pocket.
Emergency room doctor Jaylene Rodriguez Fernandez practices medicine a bit differently.
On my physical examination, I will look for any signs, and I have to actually verbalize what I'm seeing, what I'm doing.
She does that so her AI assistant in the room can listen.
I just practice medicine, and the app does everything else for me.
With the patient's consent, the AI records a verbatim transcript of the conversation. In real time, it catches vitals, symptoms, and medical terms the doctor and patient say. It then uses all that information to create the patient's chart, give possible diagnoses and possible next steps. It even recognizes and translates different languages on its own.
And once the doctor leaves the room, everything's written down, almost as if the room was listening to them.
I reviewed the note. I just looked at everything is correct.
At the end of the day, you're still the doctor.
Yes.
I love watching the space being used the way we dreamed it would be.
Wendy Brandon has been UCF Lake Nona's CEO since it opened 5 years ago. She was a hands-on part of the design process, figuring out where they could use technology to make doctors' jobs easier and their care better.
Why lean into all of this tech?
Why not do that? If we don't, we're missing out on great opportunity. The power of AI to take infinite amounts of data and simplify it so that we can see what the real problem is and how to treat is beyond anything we've ever seen before.
Right now, the hospital uses 3 different AI brains, so to speak. Ambient documentation in the ER, Timpani, which helps with scheduling, and Nurse Handoff, which engineers and nurses developed in the hospital's medical surgical unit. It helps with their notes and charting, keeping information flowing seamlessly and in the palm of their hands.
That can take a lot of time away from the bedside. It takes a lot of time where they're up at the station, sitting at a computer. With this new handoff tool, it allows them to actually have that information right on their phone.
Internal survey data between 2024 and 2025 shows 14% more patients gave physician communication the highest rating, feeling better informed about the care they were getting. Brandon says that's a direct correlation to when they started using the tech. And they're not done. A team of 600 doctors, data scientists, and more make up the system's innovation team, researching and designing tech for all 192 HCA hospitals.
So where are we going? Where does this road lead us?
Well, the hospital is growing and expanding. As we speak today, we have our first big expansion project that started just last week.
But even with a focus on pushing medicine into the future, Brandon says it's still all for people and by people.
You are people being cared for by other people, and that will always be at the center of our work.
They say that focus on people drove the design of really the entire hospital. Staff come and go from back entrances, waiting rooms are near windows, and even the placement of tables and plants is all meant to keep stress levels low. Now, when it comes to medical data and tech, privacy becomes a factor. They say all of this happens on their private servers, keeping staff and patient data safe, and the nurses and doctors are still the ones doing the actual medical work. Stu?